Hello friends, I am Dr. Aishvarya Kaushik, your original guru for conservative dentistry, endodontics and dental materials. And today I have with me our academic director, Dr. Himani Joshi at DBMCI MDS. Now friends, NEET is round the corner. NEET 2024 is most likely to be held in March 2024. Roughly around 5 months to go, guys, right? Very critical period for all of you. And most of us, many of us, have done almost, say, roughly half of the subject very seriously. Half of the syllabus is kind of lackluster. We are not very confident with our revision. And today we are going to discuss the strategy for all you guys. The first and foremost thing that we want to tell you is don't get disheartened. Don't get disheartened, Dr. Himani. I think 5 months, yes, not a very long span of time, but the duration, if managed correctly, even you guys who are not that confident with your time management, if you do it correctly and in a systematic manner, I think you can crack the examination with flying colors.
I think so, sir. It's not a small time. 5 months, all you need is a strategy. All you need is a method. Those who have joined clinics, those who were interns, could not get time during internship. You know how you should now manage your time so that you break through the exam with flying colors. All right. So I think half of your preparation must be done. At least some subjects you would have done by now, and few subjects you have not touched at all, and few are like half done or half not done. You have to do two things. Finish your first revision by December. All right. Sometimes what we tend to do is some subjects we really like. And we do that first and we start the second revision of that subject. And the subjects which are left, they are left till the end. Don't let that happen, because NEET may all subjects now have equal weightage. 14 questions anatomy, 14 questions physio-biochem, 14 questions pathomicro, 14 questions DADH, 14 for dental materials. It's an absolutely equal weightage exam now. So all subjects have almost equal weightage, if not less or more. Yeah. So your first thing that you have to do is by December, you have to finish reading all the subjects that you have not read, that your first revision is remaining. Don't worry whether how you will revise, how you will do second revision. First target is finish your first reading of all the 19 dental subjects. And like sir and I were discussing, you can just split your day into the morning and evening. Morning you can do your theory. Evening, you can do your questions. Now, what is theory, sir? How can they do their theory of that subject?
So first and foremost, Dr. Himani, I think many of us have this confusion of, going back to the textbook and trying to read the entire textbook because of whatever, because of over-enthusiasm, because of thinking that, reading the textbook will give us better results. Yes, no doubt. Reading the textbook is the best way, the ideal way of doing it. But we are short on time, guys.
Yes.
We have to cover our rest remaining. Say, for example, half of the subjects, half of the topic is remaining. So 8 to 9 to 10 subjects we have to cover completely by December, right? So use your present resources, use your notes, use your synopsis, use your videos. See your videos. Wherever you feel that you're not that confident, refer to both comprehensively the videos and the timestamped notes, right? Add to your notes. You can refer to the textbook, for a very short duration of time, but don't rely on reading the entire textbook or reading the entire chapters from the textbook. You don't have that kind of time, guys.
Correct. And you have notes for every topic, for every subtopic. Wherever you feel confident, you can just skip through the notes. You can skip watching the videos. Wherever you feel that, suppose there is distraction osteogenesis, which I've never read or never heard of, and I find it very difficult, just turn on your video, just listen to that video. You have the notes, you just add on to the notes and finish understanding that concept from the videos and notes so that you have time to revise. All right. 1 revision, 2 revision will not help you. At least you will have to revise the same thing 2 to 3 times so that you will be able to reproduce the answer in exam. So suppose if you have 10 subjects left, by December, you can just divide your 80 days. Broadly, there are 80 days. 80 divided by 10 subjects, you have grossly 8 days per subject. So by December, divide 80 into the number of subjects that are left and allot that many days to every subject. Suppose I have 8 subjects which I have not touched. So I will divide 80 by 8 and I'll have 10 days per subject, which is not a short time. To read that subject nicely, completely, and understand all the subtopics, I think 8 to 10 days is very good time, sir.
Yeah.
Watch the video, read the notes in the morning where you are fresh, where your mind is not saturated. And in the second half of the day, go to the question bank, read the questions, do the subject-wise test, practice doing the questions along with the explanation. So first half, do the theory, second half, do the questions. Plus, every second or third day, give a full paper test. That will be the actual, I think the main run through for the main NEET exam that you're going to give. It's not going to be an ortho exam or a pedo or a perio exam. It's going to be a test of all the 19 subjects, 240 questions, 180 minutes. So practice that, strategizing the time, and it will only and only come with practice. So I think, sir, every, twice a week or thrice a week, they should practice the full syllabus in the form of grand test, in the form of mock tests that your academy has to offer or that DBMCI has to offer. Plus, if you need help, you can go back to the videos and watch the videos. All right. So after December, when your first round is nicely over, please, I remind you again, don't miss doing any subject. All right. Use your notes wisely. Use your videos wisely, use your question bank wisely, use your Telegram group where you can just post all the doubts that you have. Make the most of the mentorship sessions, make the most of your faculties, whichever academy you're in, just make the most of it. Ask whatever doubts you have, post your doubts. I'm sure they must be answered very, very nicely and quickly. And in the last 2 months, in January and February, revision is what you need. All right. You will have around 2.5 days for every subject. In those 2.5 days, half day for a quick 8 to 9 hours revision of the full subject in a rapid manner. You can just take the help of a course, and for the next 2 days, you can do your own revision. You can do your questions, you can do your, question papers, the grand tests, the full syllabus tests and everything. All right. So just to summarize, sir, if you want to summarize the strategy.
Yeah, so I think we've broadly divided our time duration of 5 months into 2 milestones. The first 3 months and the next two, around 2.5 months. Till October, November, December, complete all your subjects. Don't rely too much on theory and textbook. Give equal weightage to MCQs. Do as many MCQs as possible. That's number one. Second, try to do MCQs simulating the exam environment. So do your full grand test at least twice a week, right? And then during the last 2 months, that is, we are looking at a time window of January and February before March. Do your vision videos in which you're able to completely, have a bird's eye view of the entire subject, and again, rely on as many MCQs as possible.
Yes. So give tests, my dear friends. Test is what you're going to give on that NEET day, 9 a.m. to 12 p.m. or 10 to 1, just that 3 hours. Get up in the morning, get up on time, get ready, sit in front of your computers and give tests. Give as many tests as you can. That will be the best practice for that main NEET exam. All right. So I think both Dr. Aishwarya and I, we wish you all the very best for the upcoming exams. If you have any questions for us, if you have some doubts regarding the strategy, you can always leave us a message and we'll be very happy to help you.